Hello, my name is Morgan Stoa. I am currently a teaching specialist at the University of Minnesota College of Pharmacy. I graduated from the Cook Residency Program in 2018. I was there during the years of 2017 through 2018, and I graduated in July of that year. I like I said, I'm a teaching specialist at the College of Pharmacy, so I teach in the pharmaceutical care skills lab sequence, where I teach students how to make sterile as well as non-sterile medications for patients, and also teach them how to provide medication counseling as well as the basics for ambulatory care for patients as well. I do have a dog, so I apologize if you hear him in the background. But I also teach a couple of online classes for undergraduate students as well as students in pharmacy school and some health professional students as well. So I get a kind of a robust little sphere of teaching right now. Um, Currently, I really feel like Kook set me up well for my current position. I completed a teaching certificate, which is one of the unique offerings that the College of Pharmacy Ambulatory Care Residency Program offers. And because the Kook resident staffs 2 semesters within the PCLC lab sequence, I was able to be exposed to a lot of teaching opportunities, and I really found that I was very passionate about teaching, and so I decided to pursue that additional teaching certificate, as I knew it would set me up well if I ever wanted to pursue a position in academia. But I also practice 2 half days a week at the nurse practitioner clinic in downtown Minneapolis. So I really learned skills on how to act on an interdisciplinary team and using that teamwork to achieve patients' goals with their own medication and their own treatment plans. So I really feel like Kook taught me wonderful skills of being part of an interdisciplinary team. At Kook, we have access to pretty much nearly every single specialty as far as primary care goes. So I really got the opportunity to work with MAs, nurse practitioners, uh, MDs, psychiatrists, midwives, dentists, the whole gambit. So it was awesome to have to learn how to speak different languages for these different professions. And I think that really set me up well for my current position and current spot in clinic. One of the most valuable learning aspects about Kook, I think, is it really provides you the opportunity to get to know a lot of different patients and a lot of different disease states. So Kook is an incredibly busy clinic, and as such, pharmacy is so well integrated into that workflow that they really get the opportunity to meet with many patients and help support those providers with managing many different disease states. So it's not just only treating hypertension or diabetes. We're involved with helping with a lot of other medication conditions as well. And I felt like I really got to challenge myself to develop a really sound understanding of pharmacology and pharmacotherapy for a variety of different health conditions, which I think is a very unique situation to the Kook Clinic. And I'm very thankful for that. Um, the reason I chose Kook was I was interested in helping patients in an underserved patient population. Over my time in pharmacy school, I really decided that I really found myself engaged in patient interactions and helping solve problems for patients using my pharmacy brain. So I also participated in the Phillips Neighborhood Clinic at the University of Minnesota, which is in a neighboring community to the Kook Clinic, and I really enjoyed working with the patients and serving them. So it was kind of a natural fit for me to look at the Kook Clinic. And then one of my passions is psychiatry. So the Kook Clinic is one of a very unique clinic where primary care and psychiatric care are actually integrated into one single clinic, and it's only divided by a very small wall. And so I was very interested in bringing my passion about psychiatric pharmacy and how that integrates into primary care, as well as bridging the gap between psychiatry professionals, psychiatry professionals as well. So those are a couple of things that really drew me to Kook, and um, I really, really enjoyed my time as a Cook resident. It was busy, but I learned so much, and I consider myself thankful every day that I had that opportunity to be able to learn from the great preceptors, both pharmacy preceptors as well as the medical professionals, NPs, MAs, all the clinic staff. You really get the opportunity to just learn from everybody, which I felt was an awesome experience as well. And I think that you really get the opportunity to develop some sound skills that will help set you up as a professional in the future. Um, and then I just love that there's kind of this little community of the Kook family amongst the pharmacists as well as the residency graduates. And I really feel like they're on my team even now that I don't go to the clinic every single day. So I really do feel truly blessed that I had the opportunity to be at Kook. So that's a little bit about me and my experience at Kook. I hope that you guys are interested. If you have any questions, you can feel free to reach out. I'll provide my contact information if you have any questions. Otherwise, I hope you have a great rest of your day, and I hope that the residency application process goes well for you. And that's my dog Loki, and he says hi too. He was there when I was a resident and he got kennel cough twice, so that was super fun. But anyway, it was nice to talk to you guys. Have a great rest of your day.